Why can't I stay focused like everyone else? Why do I keep making the same mistakes? Why is everything so overwhelming? What if people think I'm careless or lazy? These are just a few of the questions you may be struggling with if you have attention deficit hyperactivity disorder, ADHD. Let's talk about 9 symptoms of ADHD and how to treat this condition. Hi, my name is Dr. Air and I'm a board certified lifestyle psychiatrist. According to the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, the correct terminology is attention deficit hyperactivity disorder, and there are 3 types. Number 1 is the predominantly inattentive presentation. Number 2 is the predominantly hyperactive and impulsive presentation. And number 3 is the combined presentation. For years, people with ADHD were stigmatized and labeled as procrastinators, irresponsible, or lazy. This is more common with people who have the inattentive type of ADHD, which some refer to as ADD, Attention Deficit Disorder. So what are the 9 symptoms of the inattentive type of ADHD you need to know? Number 1, failing to pay close attention to details or making careless mistakes in school, work, or other activities. You may overlook or miss details or end up with inaccurate work. So imagine you're in a race, sprinting towards the finish line, but with every step, tiny hurdles pop up, unexpected and easy to miss. These hurdles represent the small details and tasks that most people naturally notice and navigate without much effort. For someone with ADHD, however, these details can become invisible obstacles. Whether it's in school, at work, or during everyday activities, the ability to focus on fine details often feels like trying to catch water with your bare hands. You may be reading a question on an exam, but halfway through, your mind drifts and you miss a crucial part of the instructions. At work, you might be preparing a report only to find out later that you overlooked an important figure or a key point. These are not just occasional slip-ups, they occur all the time. Number 2, difficulty sustaining attention in tasks or play activities. Some people may struggle to remain focused during lectures, conversations, or lengthy reading. For instance, imagine assembling a piece of furniture. Halfway through, you realize you've missed a crucial step back in the beginning, and now the whole structure is unstable. It is frustrating, and it's more than just being careless. Number 3, not listening when spoken to directly. Your mind may seem elsewhere even without any obvious distraction. It's like having a TV in the background while someone is talking to you. Even though you're looking right at them, your brain is tuned to a different channel. They might say something important, but your mind is busy with thoughts like daydreaming or thinking about what's for lunch. It's not that you're ignoring them on purpose, it's more like your brain just drifts away. Number 4, not following through on instructions and failing to finish schoolwork, chores, or duties in the workplace. For example, you may start a task but quickly lose focus and be easily sidetracked. You get distracted by other things like a favorite game or a thought that pops into your head. Before you know it, the task is left half done and you've moved on to something else. Number 5, difficulty organizing tasks and activities. Examples include difficulty managing sequential tasks, keeping materials and belongings in order, messy disorganized work, poor time management, and failure to meet deadlines. Imagine putting together a puzzle, but all the pieces are scattered around the room. It's hard to know where to start and keep track of what goes where. That is what it feels like to organize tasks and activities when you have ADHD. Your brain might jump from one thing to another, making planning challenging. You might forget essential steps or have trouble keeping everything in order. It's like trying to juggle too many balls at once. They keep dropping and it's hard to keep everything in place. Number 6, you may dislike, avoid, or be reluctant to engage in tasks that require sustained mental effort. It's like trying to climb a steep hill that never seems to end. Tasks that need a lot of focus, like doing homework, filling out forms, or reading books, can feel exhausting. You might start, but then quickly lose interest, like running out of gas halfway up the hill. It's not that you can't do it, it just feels hard to keep going. Number 7, you may lose things necessary for tasks or activities such as school materials, pencils, books, tools, wallets, keys, paperwork, eyeglasses, and even phones. Imagine trying to keep track of a handful of marbles. Whenever you think you've got them all, one slips away and rolls under the couch. That's what it's like to keep track of important things when you have ADHD. You might put your keys down somewhere and forget where you left them. Or you could pack your bag for work, but your important project is missing when you arrive. It's almost like playing hide and seek with your stuff. This can make it hard to be ready and organized for school or work. Number 8, you may find that you're easily distracted. These distractions may be from things happening around you or even unrelated thoughts. It's like trying to read a book in a room full of loud noises and flashing lights. Even if you really want to focus, your attention keeps getting pulled away. A sound from outside, a buzzing phone, or even a random thought about what's for dinner can make you lose track of what you're doing. Your brain feels like a magnet, attracting every little thing that's happening around you. It's hard to stay on task because your mind keeps jumping from one thing to another like a ball bouncing around. Number 9, you're forgetful in daily activities such as doing chores, running errands, returning calls, paying bills, or keeping appointments. It's like having a to-do list written in disappearing ink. You know there are things you need to do like chores, running errands, or calling someone back, but the reminders just fade away from your mind. You might start out remembering to pay a bill or go to an appointment, but then it slips through the cracks. This forgetfulness can make it tough to keep up with everyday tasks, leaving you feeling frustrated and overwhelmed. So, is ADHD just a part of who you are? Does it define you? Do you feel asking for help feels like admitting defeat? That should not be the case. There is so much information out there, but let's talk about how to treat this condition. There are 2 broad categories of treatment for ADHD. The first is with medications, the second is without medications. Let's start with the first one. Treatment with medications is considered to be the first-line treatment of ADHD. Stimulants are the first choice of medications because they are the most effective and have generally mild side effects. Examples of stimulant medications are Ritalin, Concerta, Metadate CD, Focalin, Adderall, and Vyvanse. Some of these medications are short-acting, meaning you take them twice a day, while others are long-acting, meaning you take them once a day. Longer-acting once-a-day prescriptions are generally favored for their convenience and reduced rebound side effects. While we consider stimulants the first-line medications, there are second-line medications used to treat ADHD. Examples of such medications are atomoxetine, also known as Strattera, bupropion, also known as Wellbutrin, venlafaxine, also known as Effexor, clonidine, also known as Catapres, and guanfacine, also known as Tenex. One common question people have about many of these ADHD medications, especially the stimulants, is the side effects. All medications have side effects, but many studies show that most stimulants for ADHD are relatively safe. The common side effects of stimulants include decreased appetite, weight loss, difficulty sleeping, headache, abdominal pain, mood swings, and anxiety. Other side effects include increased blood pressure and pulse, tics, nausea, dizziness, and speech disturbance. Even though possible side effects exist, this does not mean that you will get them. You should, however, follow up with your doctor to monitor your dose and reaction to these medications. Now, on to the second, treatment without medications or using a holistic approach. This includes mindfulness techniques, meditation, regular exercise, eating healthier, and stress management techniques. Therapies can also help you cope better with this condition. Cognitive behavioral therapy is a treatment style that some therapists can use to help your ADHD symptoms. They can also help you with journaling, improving your productivity, and time management. Watch this next video to learn about 5 common foods to avoid to keep your brain healthy.